Hello, dear friends. Welcome to Sri Gajanan Netra Rugnalaya. Today, we will be discussing a case of 60-year-old female who is one-eyed, high myopic, and have a hypermature cataract. Most of her lower one-third of the cornea is covered by a dense vascularized corneal opacity. She is desperate to see the world, and it was difficult to take the decision whether to operate this case in a private institute or not. But I took the chance and started the case. To plan with the initial small microrhexis was intended so that I can plan and extend the rhexis on latter part. So initially starting with a needle and then completing a miniature rhexis with the help of forceps, washing all the loose cortex with the irrigation aspiration cannula will remove the tension inside the capsular bag, and this will help us to enlarge our rhexis with the help of forceps. So, and again injecting the viscoelastics inside the anterior chamber and filling the bag with the viscoelastic so that there is a very small nucleus floating inside the bag can be handled. Taking the incision over the capsular rim with the help of microrhexis scissor and slowly enlarging the capsule and the rhexis with the help of microrhexis forceps. Actually, as initial part, I lose the control over the capsule due to corneal opacity as it was not visible, and it was again a better because the capsule larger part of the rhexis open area was in the visible part of the cornea. And now we will start with the phacoemulsification procedure. There was a major challenge in the phacoemulsification. It is a high myopic eye, a small nucleus, and it is small but hard, and there is a loose bag, and most of the area is not visible due to overlying corneal opacity. So to start with, I adopted a new technique in which I shifted in between chop and quadrant removal. So you can see I moved the nucleus in a visible part of the cornea, chopped it, and once the chopping is completed, the separated piece is then removed with the help of quadrant removal again. Again shifting to the chop mode, again moving the nucleus in a visible part of the cornea, moving it away from the opacity so I can visualize it, and then visible nucleus is chopped, part is separated, and again shifting to the quadrant mode, the nucleus, the separated part is removed, again moving the nucleus, and this procedure goes on until the whole of the nucleus is removed. Once the nucleus is completely removed, bag and antechamber is filled with the viscoelastic, and exactly what we have followed while removing the nucleus, opposite thing is done while removing the cortex. First, the cortex below the opacity is removed, and then the cortex below the visible area of the cornea is removed so that we will be sure that there is always a cortical support while removing the blindly the cortex below the opacity. So there is an opposite approach while removing the nucleus and while removing the loose cortex. The single piece hydrophobic monofocal IOL was implanted in the bag, and once the IOL is implanted in the bag, make sure that the whole of the both of the haptics are below the capsule. So this is 3.5 diopter intraocular lens, which was ordered by an Indian company. And once the IOL is implanted, the complete removal of viscoelastic is very much important because in such large high myopic eyes, there is always a chances of left behind the viscoelastics, which can later date create an inflammatory reaction. To make the patient more and more gain from this corner cataract surgery, I injected a pilocarpine and triamcinolone acetate inside the anterior chamber and decided to go ahead with a optical iridectomy. So, with the help of micro scissor, multiple small incisions were taken on pupillary sphincters so that it will remain dilated in the area where the cornea is clear, so patient can gain maximum vision, and it will not be get hampered when the pupil will get smaller. So this optical iridectomy will help the patient to see more and more in the upper part of the cornea. Thank you very much. After day 15, patient has received the vision of 618, which is more than her expectation and our expectation, and will definitely change the way she wants to see the world.